Good afternoon. I'm Dr. Eric Potter, Functional MD from Sanctuary Functional Medicine, where we help lead others to healthier, more abundant life after chronic illness. We are resuming our monthly Facebook Lives and, at times, adding a simultaneous Zoom session for those who have contacted us about receiving care at our clinic. Thank you for joining us today to learn more about our approach to some common issues we address at Sanctuary. We'll start with a few minutes on each of the medical topics, then open the floor to questions. We already have a few questions from Facebook, but you will be able to leave more questions, and we will do our best to answer them as time permits. Getting this set up and to see this as it comes on. So at Sanctuary, we hear a lot of requests for help with unrelenting fatigue. People are very tired of being very tired. This is not just the fatigue of one bad night's sleep, nor that of overdoing it during a workout or stressful phase of life. This is the I can't get out of bed and the I can't exercise without being wiped out for 3 or more days type of fatigue. Their fatigue is making a mess of their lives, and they want help. We offer them a healthier, more abundant life. Of course, we always start with the in-depth life story, starting from the beginning to look for clues to the present to understand what they need right now. We want to know about their health throughout their life. Details like early infections, early medication exposures, or toxin exposures. We want to know about life events that preceded the symptoms, physical or emotional trauma, moves or job changes, travel, or anything else that might have triggered the fatigue. Then we apply a functional medicine, personalized, comprehensive root cause search. We look for clues to the presence of toxins like the heavy metals, mold toxins, or organic toxins, and test where suspicions arise. We look for clues to hidden infections like Lyme, Mycoplasma, Epstein-Barr, and more, then run tests to confirm. We evaluate body systems like the GI tract, the hormone system, and the energy cycle. We measure inflammation levels that may be impacting their health. We tailor a specific set of tests to confirm and uncover the root causes for each patient. Each of these influences can contribute to the patient's fatigue. Most often, a combination of these factors produce the fatigue rather than just one factor. As we begin to fit the puzzle pieces together from the life story, together with the physical exam clues and answers from these advanced labs, we formulate a unique protocol for the patient sitting in front of us. We combine different mini protocols into one that fits their unique needs. When we sit down and present the results and protocol to the patient, their eyes open, the light bulb goes on, and relief sets in. Finally, someone has answers instead of just saying, all your basic tests are clear. Nothing is really wrong with you. We can tell them why they are tired and what can be done to recover. As we walk them through implementing the protocol over weeks and months, we treat their toxicities, overcome their infections, lower their inflammation, balance their hormones, and lead them to a healthier, more abundant life in which fatigue no longer controls them. Let's move on to biotoxins for a few minutes. At Sanctuary, we hear a lot of requests for help from those whose symptom list is quite long. They have multiple symptoms that cross multiple body systems. This is not just a one system issue, and they often assume that they must have 3 or 4 or 5 different diseases to explain it all. Their long list of symptoms are making a mess of their lives, and they want our help. We offer them a way out of endless doctor visits. The majority of these patients turn out to have a biotoxin illness, often mold toxicity. Biotoxins can include mold toxins, Lyme toxins, Bartonella, toxic algae exposures, and other natural toxins. Let's narrow our focus to the mold toxins for the moment, and to how we can free patients up from their grip. In order to diagnose and treat mold toxicity, we always start with the in-depth life story, starting from the beginning to look for clues to the present to understand what they need right now. We want to know about their health from early life. Again, details like early infections that might indicate chronic mold exposure in childhood. We want to know about life events that preceded the symptoms, housing moves, job changes, school changes, travel, or water leaks in their homes that might have exposed them to mold. Then we apply a functional medicine, personalized, comprehensive root cause search. We look for other possible toxins that may exacerbate mold toxicity. And we look for infections that can invade when mold toxins suppress the immune system. We evaluate body systems like the GI tract, the hormone system, the energy cycle for mold toxin effects. We measure inflammation levels and determine what damage may have already occurred. Often, a combination of these factors amplify the symptoms that mold toxins cause first themselves. As we begin to fit the puzzle pieces from the life story together with physical exam clues and answers from these advanced labs, we formulate a unique protocol for the patient sitting in front of us. We combine different mini protocols into one that fits their unique needs. We teach patients about binder therapy and support strategies to heal the body during detox. When we sit down and present the results and protocol to the patient, their eyes open, the light bulb goes on, and relief sets in. At times, they need help in understanding how one thing like mold can make them so sick. At times, they are just excited that someone has finally taken their suspicions about mold seriously. We can tell them why they are so sick and what can be done to detox from the mold. We can tell them that they aren't crazy. As we walk them through implementing the protocol over weeks and months, we see them start to smile again and live again as we lead them to a healthier, more abundant life in which mold toxicity no longer controls them. Let's move on to dizziness and lightheadedness for a few minutes. At Sanctuary, we hear a lot of requests for help with dizziness or feeling lightheaded. People are either constantly worried about falling or just miserable from the persistent symptom. This is not just the dizziness of standing up too fast. This is the I have to sit down, sit back, or hold on to the wall, and the I can't get up to do any meaningful work because of the dizziness. Their dizziness is making a mess of their lives, and they want help. We dig deep to uncover the reason for their dysfunction. Of course, we always start with the in-depth life story. From the beginning to look for clues, to the present to understand what they need right now. We want to know about their health from early life. Details like early infections, early medication or toxin exposures. We want to know what is now triggering their symptoms and what has provided some relief in the past. Then we undertake a personalized, comprehensive search for the root cause. As always, we look for clues to the presence of toxins like heavy metals, mold, or organic toxins, and test where suspicions arise. We look for clues to hidden infections like Lyme, Mycoplasma, Epstein-Barr, and more, and run tests to confirm. We evaluate body systems like the GI tract, the hormone system, and the energy cycle. We measure inflammation levels that may be impacting their health. We look for any factors in their nervous system that participates in balance. We tailor a specific set of tests to confirm and uncover the root causes. Each of these influences can contribute to the patient's dizziness. Most often, a combination of these factors produce the dizziness rather than just one factor. As we begin to fit the puzzle pieces from the life story together with physical exam clues and answers from these advanced labs, we formulate a unique protocol for the patient sitting in front of us. We combine different mini protocols into one that fits their unique needs. When we sit down and present the results and the protocol to the patient, their eyes open, the light bulb goes on, and relief sets in. Finally, someone's answers, instead of just saying, all your basic tests are clear and we can't find anything wrong, we can tell them why. they are dizzy, and what can be done to recover. As we walk them through implementing the protocol over weeks and months, we treat their toxicities, overcome their infections, lower their inflammation, balance their hormones. We basically treat the root causes instead of just applying band-aids. We work to lead them to a healthier, more abundant life in which dizziness no longer prevents them from living. Let's move on next to GI troubles for a few minutes. At Sanctuary, we hear a lot of requests for help with gut issues. People are afraid of eating due to unpredictable GI symptoms. They get nauseated, they have diarrhea, they feel bloated. They have tried multiple diets without consistent success. Their belly is making a mess of their lives and they want help. Of course, we always start with the in-depth life story. From the beginning to look for clues to the present to understand what they need right now. We want to know about their health from early life, details like early infections, early medications like antibiotics, or maybe toxin exposures like glyphosate. We want to know about those antibiotic exposures that preceded the symptoms. We want to know about their nutritional patterns, current and past attempts to change their diet. We want to know about other triggers that may not be obvious. Then we apply a functional medicine, personalized, comprehensive root cause search. We look for triggers of dysbiosis, leaky gut, histamine reactions, or SIBO, and run tests to confirm presence and severity. We look for clues to the presence of toxins like heavy metals, mold, organic toxins, and test where suspicions arise. We work through a detailed evaluation of both the primary GI tract and the secondary effects that can arise from the gut dysfunction. We measure inflammation levels that may be impacting their health and their gut ability to work for them. We tailor a specific set of tests to confirm and uncover the root causes. Each of these influences can contribute to the patient's nausea, pain, diarrhea, and food reactions. As we begin to fit the puzzle pieces from the life story together with physical exam clues and answers from these advanced labs, we formulate a unique protocol for the patient sitting in front of us. We combine different mini protocols into one that fits their unique needs. For the gut, we start them on a restoration protocol from the beginning, even while waiting on lab results. Then, when we sit down and present the results and the protocol to the patient, their eyes open, the light bulb goes on, and relief sets in. Finally, someone has answers instead of just saying, all your basic labs are normal and clear, nothing is really wrong. We can tell them why their gut is messed up and what can be done to recover. As we walk them through implementing the protocol over weeks and months, we treat their gut inflammation, their leaky GI barriers, lower their histamine levels, improve their digestion and absorption, and we lead them to a healthier, more abundant life in which GI symptoms no longer control them. For the last one, let's move on to health problems in children for a few minutes. At Sanctuary, we hear a lot of requests for help from parents who know something is wrong with their child. Parents know their children and know when something is different. This is not the irritable child from staying up too late, nor the upset tummy of not wanting to eat their veggies. This is the my child woke up with a different personality and never came back. Or the my child got a vaccine and it's never been the same. Something happened and the parent wants their child back to normal. We offer explanations and path to recovery for those children. Of course, we always start with an in-depth life story. Even the story may only be a few years old, we start back during the mom's pregnancy for clues and follow through looking for the fingerprints on the trigger that changed everything in that child. Details like early infections in mom or the child, early medication exposures or toxin exposures are important for both mom and the child. We want to know any details that could lead us to a solution and a return to normalcy. We apply a functional medicine, personalized, comprehensive root cause search, just like with adults. We look for clues to the presence of toxins like heavy metals, mold, organic toxins, and test where suspicions arise. We look for clues to hidden infections like Lyme, Mycoplasma, Epstein-Barr, and more, and run tests to confirm these. We measure inflammation levels that may be impacting their health. We tailor a specific set of tests to confirm and uncover the root causes. Each of these influences can contribute to the child's food allergies, autism, ADHD, autoimmune disease, or other conditions and symptoms. Sometimes it comes down to one trigger. Sometimes 2 or 3 triggers combine to produce the disease. As we begin to fit the puzzle pieces from the life story together with physical exam clues and answers from these advanced labs, we formulate a unique protocol for the child sitting in front of us. We combine different mini protocols into one that fits their unique needs. When we sit down and present the results and the protocol to the parents, their eyes open, the light bulb goes on, and relief sets in. Finally, someone has answered for the child's condition instead of just hearing, all the basic tests are clear. Nothing is really wrong with your child. Isn't that good news? When they know that something is wrong, we can often tell them the why their child changed and what can be done to recover their child's life. As we walk them through implementing the protocol over weeks and months, we treat the toxicities, overcome the infections, lower the inflammation, balance the neurological development, and lead them to a healthier, more abundant life in which their child is no longer trapped in a chronic illness without answers. Okay, with that behind us, let's look to any questions that the audience has for me. We have a couple of questions already before we started. For Facebook, if you want to leave a question, just type it in and I will field them as they come in. So the first question from Ms. Coons, daughter has POTS, postural orthostatic tachycardia syndrome, due to hypermobility and inflammation. I know people that no longer have any POTS due to addressing the inflammation. Any thoughts on this type of POTS? Thank you. So again, postural orthostatic tachycardia syndrome. This is a condition in which your body is not able to control blood pressure, pulse rate, and therefore keep you upright. When you're lying, your blood pressure is pretty much even from toe to your head. But when you stand up, your body has to do something to keep all the blood pressure up high enough in your head for your brain that you don't get lightheaded, or the fact your heart has to go so fast or beat so hard that you feel weird. So those with postural orthostatic tachycardia syndrome can be children or even young adults, and even some adults who can't control that blood pressure and pulse to balance when they stand up. So a lot of them will have a dip in blood pressure, they'll feel lightheaded and their heart races, and they get pretty miserable when they're upright and spend a lot of time sitting or lying down. What happens is, normally in our legs, your blood vessels should constrict slightly to keep more blood up into your upper part of your body until you lie down again at the end of the day. In these patients, when it leaves more of the blood down their lower half of their body, their brain doesn't get enough and they feel weird. It can cause some cognitive symptoms and again, the cardiac palpitations and so forth. With that, I mentioned hypermobility. That's when joints go further, the whole double jointed, whether your elbow makes a V upside down. I can't do it, but you could put your hands behind your back and your fingers can overlap. Mine do not touch. I'm not that flexible. The person who can go down and put their hand flat on the floor with pretty much ease while the legs are still straight, or if you look, they try to straighten their knees and they actually go back. So that's a hypermobility situation, and that can include skin. There are some genetic conditions called Ehlers-Danlos, Ehlers-Danlos, where that occurs because there's collagen, the connective tissue defects. But POTS often comes with hypermobility because the blood vessels are a little extra stretchy, and they end up getting blood pressure that does not go up because those blood vessels cannot constrict again. With that, that can be a condition that someone is born with, but you can minimize that because there are other acquired conditions like mold toxicity, inflammation, infections, which can exacerbate. So while you cannot change someone's genetics, if you find out, oh, it's half genetics and half some environmental situation, condition, toxicity, or infection, inflammation, and you fix those, you can return someone back to a functional state, whereas possibly their POTS was causing a lot of issues, their hypermobility was causing problems. The other thing you can do, like say mold toxicity, biotoxins, that interrupts your ADH, antidiuretic hormone, and your blood pressure may run low, or your cortisol made by your adrenals, another hormone, may run low often, which then makes someone who already has some mild POTS have much worse. You improve those hormonal issues, improve the blood volume, and then you've got more blood to push up into the brain to stay upright or not have the palpitations, as I mentioned. So yes, there are a number of things that can be done in those situations if you can get, again, as we talk about in functional medicine, a root cause identification of the trigger, going deep and not just treating the Band-Aids or just saying, oh, well, let's just give you something to keep your blood pressure up or give you something that doesn't allow your heart to speed up too much. We're wanting to get to the root cause. So yes, there are some things that we can do and help a number of patients. We see that a lot in the Lyme patients, Bartonella or mold toxicity, and especially in our teenage age range, and help a lot with that. The next question, are you familiar with cases of chronic joint subluxations and joint pain in every part of the body? If so, what are your thoughts on potential root causes and how would you test for them? Thank you, Ms. Wolf. So, first of all, if you don't know what a subluxation is when your joint, which normally is connected by ligaments and tendons and fits in together, pops out. So if somebody has had their shoulder pop out of place, that's a subluxation. If you've had your knee pop out. So that can go in and out depending on how loose those ligaments are. Some patients, as we talked about with hypermobility earlier in that first question, they can have that happen to the joints. They're so loose, not only can they bend their elbow past, it will pop out of place. And it can be, as you might imagine, rather uncomfortable. So for those patients, there are things you can do if they have an inability to reform connective tissue after injuries. There are some therapies you can do to help improve that, whether it's collagen, hyaluronic acid. There's some different protocols. And also, again, remove anything that's causing harm, say Lyme disease, toxins, mercury, looking for those issues. If someone has a lot of inflammation, their C-reactive protein is elevated, they're not going to be able to heal as well. If someone's hormone levels are off, particularly the anabolic hormones like DHEA and testosterone, too much progesterone can make you more loose, more ligamental laxity with pregnancy. That shows up as progesterone levels go up. But if you don't have enough DHEA and testosterone, you may not heal. So those ligaments, instead of healing back to the right length, keep getting stretching longer, and the joints start popping out. So we would look for those root causes, treat everything we could find, and also then incorporate potentially the work of a functional physical therapist. We don't have one. We are not functional physical therapists, but we often refer where they can help build joint stability and help patients learn how to use those joints in a way that's more appropriate and causes less pain. Because again, like I said, when your joints popping in and out, overextending, hyperextending, it is not a very comfortable situation if it goes too far. So hopefully that was helpful in terms of understanding some ways that we might address that and what you might look at to help with. So I'm going to see if I can pull up any questions. I'm not seeing any comments just yet. So I'm going to wait a few minutes. See if any questions come up here. It says there's some comments, but I'm not seeing anything just yet. Here we go. Ah, there we go. All right. From Miss Hubbard, what do you recommend for older adults with a lifetime of ADD, attention deficit disorder, which runs multi-generationally throughout many individuals in the family, by the way? Are there any supplements that can help with pervasive distractibility? So for one thing, again, we'd want to look, do testing, go through a good history, look for any signs that there are some defects or obstacles in the neurotransmitter, either production pathway or in the neurotransmitter metabolic pathway. And sometimes we might even go into the genetics and see if there's receptors or genetic changes in enzymes that have to do with the ability to make those enzymes or make those neurotransmitters. So with that, for example, zinc and copper is important to make norepinephrine, which you need for focus, to process dopamine, which you want the right amount of dopamine. Too much, and you can be kind of over-focused and can't interact with the outside world. Not enough, and you really can't focus down on anything. So we want to look at mineral levels. We want to make sure that you have the adequate building blocks for neurotransmitters. So we'll sometimes look at whether tyrosine, Tyrosine, or phenylalanine, some of the precursors to make dopamine, norepinephrine, and epinephrine that are main part of your focus neurotransmitters. We want to make sure that you have adequate GABA, gamma-aminobutyric acid, which is a calming that helps you from being too hyped up, hyperactive. And also we might look at whether you're getting too much glutamate, if you're a hyperconverter, or if you're getting a lot of MSG, monosodium glutamate. So we look at those things. Some children and adults find some moderate benefit from omega-3s, making sure you're getting an adequate fish oils in their diet. If you've got inflammation in the brain, in the particular area that controls focus and attention, it may be that lowering inflammation is helping. We also look at gut health. Gut health, there's bacteria that either feed off neurotransmitters or can stimulate the production of more neurotransmitters. So we want to make sure we're addressing those. A lot of research is showing that things like Alzheimer's, Parkinson's, and other brain conditions can be related to what's going on in your gut. So those are some of the things we would do. Again, some of the, depending on what we found, tyrosine, phenylalanine, omega-3s. The first two, the tyrosine and phenylalanine, you do want to be careful with. It could potentially raise blood pressure. So if you already have high blood pressure or taking blood pressure medicines, you'd want to be careful. There's also some things, green tea can be another, just drinking it or taking a green tea extract supplement sometimes helps with that. So those are some of the things. Beyond that, we need to consider testing. and see what we found in terms of nutritional balances, infections, inflammation. Another question here. Ms. Hubbard has a question. What do you recommend for older adults? Oh, that's the same question. I think it came through maybe twice. Yep. And Baxter Swint, are there cases where something shows up that is out of your scope of practice? What do you do in those cases? So we do a lot of things. I will say one thing that I can say definitely is not in our scope is natural cancer therapy. That is an example where we would encourage that person to get the opinion of both a natural and a conventional oncologist. There are good ones out there, depending on, we have people coming from different parts of the country, so it kind of depends on where they are. We will direct them to different therapy centers and get the opinion, especially if they are leaning towards the natural therapy route. Sometimes the conventional therapy can be very simple and may take care of things without having to do that much even on the natural side. But we will encourage patients who have been diagnosed with cancer, even if they know it, we'll encourage them to look those places, or if we are the ones that help diagnose that, encourage them to get those help. The other issue where we might come up is we don't do, say, GI scopes. We're not going to put you to sleep and put a scope down your throat or in your colon, but we have physicians in our area where we will refer to for procedures, or someone needed a thyroid biopsy. There's endocrinologists that will do that. Obviously, we don't do radiology. You don't do X-ray, CT, MRI. There's places that we can refer patients to get those procedures done. So we have some connections with a lot of different providers, both on more so probably on a conventional level, conventional medicine level, just because there are not as many specialists in functional medicine or alternative medicine. Occasionally, there are a handful of functional neurologists. Finding a functional gastroenterologist has been kind of hard. There's one that did start a practice in North Carolina. There are some others in various fields, but it is a little difficult. Now, we have some functional generalists who focus down in one area, and on occasion we may recommend, say, if somebody needs some limbic system retraining, there's a Dr. Lindemann that we connect patients with out of Kentucky, who's been very helpful with some PTSD or retraining the brain after toxicities. So those are some of the things we will do if it's something that's outside our scope. We also have a nutritionist. If there's something nutritionally based that we need help with, we'll have Kira work with the patient. So that's another thing we'll do. And hopefully someday we'll grow to the point that we have the Functional Sanctuary Institute of having some of those specialists, if we can encourage them to join in and work with us. Any other questions out there? We've got a little bit longer here, so now is a good time to get your questions answered. So let me think of something else that we could talk about that, okay, let's talk about migraines. While we're waiting for a question, Sanctuary, we see a lot of patients that come to us with either chronic migraines their whole life, or they were doing pretty well until something happened and they started getting migraines. And migraines are an issue of head pain, in which we believe it is a neurovascular, both the vessels and the nerves in our brain surrounding it on the surface, what's called the meninges, get inflamed or have an electrical storm, and they trigger a pain response. For those of you who have had a migraine, they can be pretty debilitating. They can cause photophobia, meaning bright light hurts the eyes and makes the headache worse. Loud noises, phonophobia. Some people have to lay down if they move around too much or exert themselves. It makes the headache worse. They can have vomiting, They can miss work. They can miss school in children. So it can be a pretty debilitating. It's actually, when you look at the number of people who have had it and how many people have to miss some productivity, school, or work when they have the migraines, it turns out to be quite impactful for even our economy and the lost days of work. So with that, besides it just being a miserable, painful condition and the impact widespread in our economy, is the fact that we want people to feel better. So with that, we will look for something that may be triggering those. We will look through triggers like foods, sometimes removing either testing or just doing some elimination trials of stopping 5 or 6 foods at a time and seeing if any of those cutting them out makes the headaches go away, or when we put that food back in after the headache got better, does the headache come back? Then we are suspicious that that food may be contributing. We want to lower their inflammation. Sugar is an inflammatory food. Processed foods may be making someone's headaches worse. We'll also look at nutritional deficiencies. If someone needs more riboflavin or CoQ10, or even if we don't test, we may just try those because a lot of patients see improvement prophylactically, meaning they take that daily to prevent headaches, and then use magnesium sometimes as a therapy after the fact if they do have a breakthrough migraine, or something called butterbur and feverfew. Now, talk to your doctor. If I'm not your doctor, you want to talk to your doctor before you implement any of these things, just because it might not be the right thing for you. Even natural therapies can have side effects and might interfere with another condition or another medication. But cutting out of food, keeping a food diary to see if certain foods may be triggering it, considering vitamins, considering adding some natural therapies in there is good. Can also look to see if some toxicities, if they have something like the mold toxins, mercury toxins from amalgams in the teeth, and seeing if any of those are causing issues, or inflammation from a chronic infection like Lyme disease, Epstein-Barr, mycoplasma, other viral issues, other chronic bacterial issues that are occult, meaning not easily noted by conventional medicine. So migraines are something that we help a number of patients with. We work through that functional medicine root cause approach, and then we treat those root causes, whether it's too much of a bad thing, too little of a good thing, or in the short run, just using anti-inflammatories and other nutritional supplements to support. And at times, we may also advise them to continue using a pharmaceutical, especially as we're working to lower inflammation. It may take weeks or months, so we will still advise them and guide them on using some of the pharmaceutical options as well. So with that, we help them get back to the point that it's not just, oh, well, you're just stuck on this medicine forever, but there's answers that at the very least, if we can take somebody, say, is having 3 to 6 migraines a week and are missing an hour or 2 or 3 or 4 hours a day from those, and take them to where maybe they're having them once a week or once every 2 weeks. When they have them, they're milder and they're not missing work. Even if they're still having an occasional one, they're actually more functional, and that is that healthier, more abundant life that we try to help people with. So those are some of the things we can do for migraines. So we've got a quiet bunch today. Any other questions out there? Well, since no other questions are coming up at the moment, I will talk a little bit about Lyme disease. So Lyme disease is another condition that we see with some frequency in sanctuary. We do live in Tennessee. There's plenty of ticks around, but practically there's some ticks just about in every continental United States. If you do any traveling, it can be an issue. Is there another question there? All right, I've just been informed. I don't see the question up here. I'll come back to Lyme later. Facebook, as we know, is causing lots of problems right now in many ways, but I'm looking to see, I don't see the question about IV therapy. Whether this is not coming up, but Ron, can you tell me what the question is? I think Ron is going to print this out for me. I'll blame this on Facebook. Do you offer IV infusion therapy for your clients? If so, what varieties? So yes. So at Sanctuary, we do have an IV therapy suite where right now we have 2 recliners, looking to add a third as things get busier, but about 2 to 3 days a week, we are providing a number of different IV infusion therapies. Our primary therapies are more geared at detox since we take care of a lot of toxic issues. These include things like glutathione and vitamin C, which cover a number of different detox needs. We also look at phosphatidylcholine, IVPC, which helps pull out a lot of fatty toxins, helps people who are having trouble cognitively recovering from anesthesia from a surgery. It also helps pull out other things, and sometimes we will combine those. Myers cocktails are the B vitamin mixes, which include the folate, B1, B2, B12, B5. Those, when people have deficiencies, we will include those in there. Those are the main ones. We're looking to expand that a little bit more, but that gets us a long way. Occasionally, some alpha lipoic acid, carnitine if somebody has a mitochondrial issue with metabolizing fatty acids, we'll work on them with those IVs. So we do that again 2 to 3 days a week. We're adding staff so we can, as we have enough right now that we can add days. It's just that we need more staff, and we're training our new IV nurse, Amy, number 2. Yes, we have 2 Amy's. It's making things fun in the back office, but where we can do more IVs and help people reach that healthier, more abundant life faster than they would otherwise. So I'm going to finish up with Lyme disease just real quick. As I was saying about Lyme disease, we treat a lot of patients with Lyme. It is an infection from something called Borrelia. There's some different subspecies from Burgdorferi, which is the main American one, to Abszelii, Guerinii, Spielmanii, Bavariensis, and some other different ones. Those are a little more overseas in different areas, but with the travel, we see different species here, even though it might not be the primary one that's normally in America. And with that, we will use therapies to detox, meaning remove toxins that the Lyme bacteria makes. We'll use therapies to improve, augment your immune system, because we want to not just lower the infection, we've got to strengthen the immune system, so we always need the immune system to finish things off. And because Lyme, like many infections, far more than conventional medicine will admit, probably sticks around in our bodies, at least in low levels, and we need a good immune system to keep it from coming back. But we can treat that with antibiotics and natural therapies, or natural therapies alone, and help people over a number of months. It takes a while. You can look out there, and some will claim that they can do rapid Lyme treatments, but I have not been impressed yet, whereas I do for those patients who are able to get through the several months of therapy, do recover and go back to living life in a way that they were hoping to, sometimes saying they heard those people say, I feel normal for the first time in 15 or 20 years, or maybe ever. Maybe they got the Lyme when they were young, which is another thing. Rarely can I tell you when exactly you got Lyme disease. I have a few patients who literally had normal test, message me a few weeks to a month or two later, oh, I got a tick bite and I've got this little funny rash on here. And we do tests and yep, the Lyme is there. That person, I can tell them exactly when the Lyme started, but otherwise it could have been there for a number of years. And then when we test to diagnose, we will screen with a conventional medicine test that's insurance covered and relatively inexpensive, even if you have to pay for it. But we will then, if it's not clear in that test, or we have suspicions and the test has missed it, we will do more advanced testing to confirm more of a yes or no answer. So with that, we will diagnose, we will treat, and we will monitor a patient until we get them through to the other side of that healthier, more abundant life. So I think, unless there's another question I'm seeing, I think we're going to wrap things up. And look forward to our next Facebook Live, topic to be determined, which will come in 2021, the year we all look forward to. Right now it's looking like January 14th, Thursday at noon, again, will be the time that we gather to do our Facebook Live and see what I can offer you in terms of training you for a healthier, more abundant life. I look forward to seeing you then.